wait. Birds and snakes and airplane. Lenny Bruce is not afraid.
Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business to be aware of what's happening out there in science and technology and health. And America is this great creator of the next technologies to solve so many of our problems. It's very disconcerting for me to sit here and watch the government's best effort to squash those developments. But we have got someone here who's a leader in this area, and I believe the company's called Aliqua. Is that correct? Is that how we pronounce it? Dave Johnson is our guest. Welcome to the program.
Kevin, first of all, thank you, and you've got the pronunciation well.
Thanks, I appreciate that. You kind of remind me of Aliqua, but that's a completely different company.
It is, absolutely.
Absolutely. Yeah, so Dave, tell us, kind of give us your elevator speech about your company, kind of doing some cool things when it comes to advancing recovery from disease and injury and that type of thing. Tell us a little bit about that.
Yeah, absolutely. And maybe, Kevin, a good place to start is just to give you a very brief background of myself to put some context around the company. I've spent 32 years in the medical device space, and really more than 25 of those running businesses. And I've done, that for a variety of leading companies in this area: American Hospital Supply, Baxter, Zimmer, and most recently was the chief executive officer of a company called Convatec. When I joined Convatec, we were a $650 million business as part of Bristol Myers Squibb, and then sold ourselves out of Bristol for $4.1 billion in 2008. I stepped down as the CEO early in 2012 as we built really four businesses with total revenues just exceeding $1.7 billion. So a nice run, and much of it due to a group of technologies in the wound care space. Wound care today, Kevin, in society continues to be an extremely challenging condition, specifically for chronic wounds and for a number of acute wounds. And so when I got out of Convatec, I had a number of opportunities to look at wound care technologies, and all of a sudden ran into a little company called Aliqua. And listen, what I saw about Aliqua was really three different things. First, this had a tremendous innovative technology around electron beam cross-linking of hydrogels, which eliminated so many of the problems associated with hydrogels in the past that use chemical cross-linking, and eliminated skin irritation completely. Second, I saw two wound care products that had been developed, one called Hydress and one called Silverseal, both of them fully FDA approved, both of them fully reimbursed, took the entire risk out of the regulatory and reimbursement climate, which quite frankly today is extremely unpredictable, and just had a great opportunity to commercialize these things.
Yeah.
And then,
well, go ahead. But you're on a much slower elevator than I usually allow myself to be in. But go ahead.
Well, listen, I saw a chance to win on two fronts here. The first front was using the hydrogel platform to really fulfill a vision, which was to be a preeminent company in the wound care space by building a suite of technological solutions that a wound care practitioner could use to manage the challenges of their chronic and acute wounds. And then second of all, use the same hydrogel patch in the area of topical and transdermal drug delivery. We believe in it strongly. We continue to build out a proof of principle. And, so much of this conviction is started by our chairman, Dr. Jerry Zeldis, who has been the chief medical officer of Celgene during these past 15 years. So that's how we believe we can win leveraging this platform, Kevin.
Yeah. Okay, very interesting. So, and I kind of look at part of your area and why your growth is so, obvious and will probably continue. There's just been a plethora of healthcare fields that relate to diabetes. And diabetes is like, one of the primary drivers behind wounds that simply won't go away. And diabetes is huge in our culture today.
Kevin, you're absolutely correct. It's one of the leading problems we have in society. Unfortunately, it continues to go up as a percentage of our population. And one of the attributes, unfortunately, of being a diabetic is having diabetic foot ulcers. And unfortunately, 50% of these ulcers lead to amputation. Yeah. And so the need to help wound care practitioners deal with these extremely difficult diseases is critical, and we think we continue to build solutions to help them do just that.
Yeah, absolutely. So, so how old actually is the company as a standalone entity?
So as a standalone entity, the company goes back about 14 years, primarily in the area of contract manufacturing. I'll say that the second startup of the company, which happened really in 2010, and then we entered into the game in late 2012, I think of that as really the second rising of this company as we now look to build the vision that I described a little earlier to you in topical transdermal drug delivery and wound care.
So let me ask you, so are you a place that patients come to, or are you an organization that works directly with physicians and healthcare institutions to implement your protocol?
Yeah, so what we have done is we continue to build a commercial organization right across the country and actually outside of the country as well. And these wound care professionals will work with wound care practitioners, help them determine what the right technology is, establish protocols of care for the different indications of the wounds that they're dealing with. And so we're working directly with these healthcare professionals each and every day.
Okay, so you're working with professionals directly or also institutions like hospitals?
Yes and yes. You know, in many ways, they're interconnected now, as so many of the wound care clinics are connected to hospitals. Accountable care continues to build out more and more of the continuum of care of a patient as they start in a hospital, they go out into the community, and these physicians continue to look after and have accountability for these patients' care. And we ride with them right from the acute institution right through into the post-acute institutions.
Okay. And so your growth is somewhat predicated on working directly through these doctors and institutions.
Yeah, absolutely. I mean, our growth is about building the right technologies, acquiring the right technologies in this roll-up strategy, and then being able to have this world-class selling and distribution organization to partner with the wound care docs to ensure they understand it, they're educated on it, and they can utilize it with patients both in the U.S. and around the world.
By the way, are you a doctor? What kind of credentials do you have?
No, listen, I'm a business guy. I'm lucky and blessed to work with some tremendous physicians and clinicians who are much smarter than me when it comes to a technical perspective, Kevin. But I run the business side, the strategy side, and of course I've been doing it for a long time, so I have a pretty good understanding of many of the technologies as well.
Yeah, I see you're the CEO of the company. So delighted to be able to spend some time with you, learn a little bit more about what you're all up to, and I want to encourage people out there to learn more. Check out ALLIQUA.com. That's ALLIQUA.com. And Aliqua is how you pronounce that. And I did it right 3 times, I think. I need to go star for my forehead. All right, before we let you go, Dave, I'm going to have my producer get a little bit of information from you. But thanks so much for being with us.
Kevin, thanks so much for your time today. We really appreciate it.
You bet. When we come back, much more for you. I want to remind you, the best content here shows up over there at usdailyreview.com. While there, like it on Facebook, follow it on Twitter.